Can a cystogram save your bladder health? Imagine catching a problem early before it causes serious damage. That's exactly what a cystogram can help do for your bladder health. A cystogram is a special imaging test that uses X-rays and a contrast dye injected into your bladder through a small tube called a catheter. This dye makes your bladder visible on the X-ray images, allowing doctors to see its shape, size, and any abnormalities. During the test, you will lie on a table while the dye is carefully injected into your bladder. Then, X-ray images are taken as your bladder fills and empties. This process helps doctors identify issues like recurrent urinary tract infections, bladder trauma, or structural problems. It can also detect urinary reflux, which is when urine flows backward toward the kidneys, or bladder outlet obstruction, which can cause difficulty urinating. If you experience incontinence or other bladder symptoms, a cystogram can provide valuable clues about what's going wrong. In the context of bladder health and bladder cancer, a cystogram is especially useful because it can reveal structural abnormalities such as bladder wall tears or defects. It can also show how well your bladder empties, which is important because poor emptying can increase the risk of infections or other complications. Detecting these issues early allows healthcare providers to plan appropriate treatment strategies to prevent further damage or worsening of bladder function. It's important to understand that a cystogram is a diagnostic procedure, meaning it helps identify problems but does not treat them directly. It is different from a cystoscopy, which involves inserting a small camera through the urethra to look directly at the bladder lining. Both tests are valuable and often used together to get a complete picture of bladder health. Overall, a cystogram can be a key tool in maintaining bladder health. By revealing hidden issues early, it helps doctors intervene before problems become more serious. It is a safe and well-established procedure, but always remember that results should be interpreted by a healthcare professional. They can guide you on the best steps forward to protect and preserve your bladder health. If you have symptoms or concerns, consult your doctor to see if a cystogram might be right for you.